Good afternoon, folks. Now, this afternoon's topic A is nurse practitioners shaping the future of care. Okay, so we will dig into that for this afternoon for A. Here we go. Nurse practitioners shaping the future of care. Nurse practitioners are not just participating in the transformation of healthcare, they are driving it. As demographic pressures, chronic disease burdens, and workforce shortages intensify, MPs are emerging as the most adaptable, scalable, and patient centered clinicians in the system. Their blend of advanced clinical training, whole person orientation, and community rooted practice positions them to reshape how care is delivered across the lifespan. Why nurse practitioners matter. Access expansion. MPs, NPs are often the first and only primary care clinicians in rural communities or counties, medically under medically underserved urban neighborhoods, and aging communities. They close gaps created by physician shortages and offer culturally competent relationship-based care. Continuity and trust. Their longitudinal approach to chronic disease management reduces avoidable ED visits, improves medication adherence, and strengthens patient engagement. Cost effectiveness. Studies consistently show NPs led care matches physician quality while lowering total cost of care through prevention, early intervention, and reduced hospital utilization. Innovation Innovation leadership. MPs are early adopters of telehealth, remote monitoring, and integrated behavioral health. They often design workflows that improve efficiency and patient experience. Policy and organizational leadership. From clinic directors to state boards, NPs increasingly shape standards, quality matrix, and workforce strategy, key areas of influence. primary care and prevention. NPs excel in early detection, lifestyle counseling, and preventative screenings, which are essential as chronic disease prevalence rises. Chronic disease management, their expertise in diabetes, hypertension, COPD, heart failure, and mental health integration makes them indispensable in value-based care models. Telehealth and digital care. Nurse practitioners lead virtual first clinics, manage remote monitoring dashboards, and deliver digital education that improves self management. Population health. They identify social needs, coordinate community resources, and build trust with populations historically marginalized by the health system. Policy and advocacy. NPs are central voices in scope of practice, modernization, reimbursement, partly, and workforce planning. Challenges to address. Regulatory barriers. Patchwork state laws create confusion, restrict mobility, and limit the ability of NPs to meet demand. Reimbursement gaps. Low, low reimbursement rates for identical services undermine stability, sustainability, and undervalue MP contributions. Workforce distribution. Despite growth, shortages persist in rural and high need urban areas where MPs could have the greatest impacts. Burnout and retention, administrative burden, productivity pressures, and moral distress threaten long term workforce stability. Public awareness. Many patients still misunderstand nurse practitioner training, certification, and scope, slowing acceptance in some regions. Practical recommendations. Expand full practice authority. Evidence from 27 plus FPA states show safe, high quality, independent nurse practitioners practice improves access and outcomes. Align reimbursement payment partly across Medicare, Medicaid, and sustainable MP models, led models, invest in team-based models, interprofessional teams that leverage MP's strengths, improve uh, throughput, quality, and patient satisfaction. Support continuing education. Supporting support continuing education, leadership, informix, leadership, informatics, and population health training prepare NPs for emerging roles. Measure and publish impact data on access, cost, readmissions, and patient experience strengthens advocacy and informs policy. Ready to use communications. Headline options. Nurse practitioners redefining primary care for the 21st century. From bedside to boardroom. Now, NPs are shaping health policy and practice. Nurse practitioners are expanding access, improving outcomes, and driving innovation across healthcare. When empowered with full practice authority and fair reimbursement, NPs, NPs deliver high quality, cost effective care, especially where it's needed most. Let's invest in MP leadership and team based models to build a healthier future. Elevator pitch, 30 seconds. Nurse practitioners combined advanced clinical training with holistic patient centered approach by expanding MP roles in primary care, telehealth, and chronic disease management. Health systems can increase access, lower cost, and improve outcomes, especially in underserved communities. Quick action list. Health system leaders. Pilot NPs led pilot pilot NPs led clinics. Measure outcomes and scale successful models. Policymakers. Modernize scope of practice, laws, and ensure reimbursement parts. Parity. Educators. Strengthen leadership, informix, and population health curricula. NPs document outcomes, publish case studies, and engage in policy advocacy. Patients and communities share stories that highlight MPs' impact and build public trust. The conversation, the evolving nurse practitioner landscape, a conversation between Michael Ralph and Annie Durant is more than an interview. It's a snapshot of a profession in motion. Their dialogue traces how nurse practitioners have grown from a small experimental role in the 1960s into one of the most influential forces in modern healthcare. It blends history, policy, evidence, and lived experience into clear narrative. MPs are redefining what accessible, equitable, equitable healthcare, relationship centered care looks like in the United States. Reef and Durant argue that nurse practitioners have become indispensable, evidence driven clinicians who expand access, advance health equality, and deliver outcomes on par with physicians while preserving the holistic patient centered roots of nursing. Their conversation underscores that the MP role is not a substitute for physicians. It's a distinct complementary model of care that the health system increasingly relies on. Key themes from the conversation: a profession born from necessity and still evolving. Durant traces the MP role back to its founders, Laura Ford and Henry Silver, who created the first pediatric nurse practitioner program to address a shortage of primary care providers. From that seed, the profession has expanded into family practice, adult gerontology, primary and acute, pediatrics, neonatal care, psychiatric mental health, women's health, emergency and acute care specialist. That diversification reflects a profession that adapts to national needs, whether chronic disease, mental health crises, or rural access gaps. Nurse practitioners are the backbone of care in underserved communities. Ralph emphasizes Ralph emphasizes that MPs often serve as the only consistent clinicians in rural and marginalized communities. Their nursing foundation, focused on prevention, education, and long term relationships, makes them uniquely effective in. Give me 1 second, folks. Managing chronic conditions, supporting behavior health, coordinating community resources, addressing social detriments of health. This is not just anecdotal, it's a structural reality of the U.S. workforce. The evidence is unequivocal. Nurse practitioner outcomes match physician outcomes. Durroughton directly confronts misconceptions about MP training. She cites decades of research showing equivalent clinical outcomes, high patient satisfaction, strong safety profiles, effective chronic disease management. This evidence base is one reason many states have moved toward full practice authority, allowing MPs to practice independently within their training. The MP model is a hybrid of nursing, wisdom, and medical expertise. Reef and Durroughton highlight what makes the MP role distinct. It begins with RN experience, grounding clinicians in holistic assessment, patient education, and relational care. It builds advanced skills in diagnosis, pharmacologically, treatment, and interprofessional collaboration. This dual identity, nursing plus medicine, is what allows MPs to approach patients as whole people, not just clinical problems. The nurse practitioner role emerged in the 1960s to address primary care shortages, a challenge that persists today. The consensus model sought to standardize nurse practitioner education, certification, and scope across states. Workforce data from AANP shows MPs now make nearly half of all primary care providers in some regions. Okay, guys, that is your A for today. I will be back on with B shortly. For now, Gator Wellness. Take care, folks.